Welcome everybody to this education training program of the Florida-Puerto Rico collaboration to reduce stroke disparities.
So there's lots of competing definitions about what disparity is, and I think the easiest way to conceptualize disparity is simply to think about differences in the distribution of any disease across a population. And so what I argue is that health disparity ensues from the interplay of multiple factors operating across multiple levels of influence. Because if we think about something like the neighborhood in which you live and potential exposure to noxious environmental attributes of that neighborhood, your disease risk may be different.
In the red is heart disease, in the gray is cancer, and the blue is stroke. And if you look across the different race ethnic groups, the biggest thing that jumps out is the numbers are greatest for mortality for heart disease, cancer, and stroke for African Americans. The point is that even though there's been an improvement, there still seems to be these disparities in terms of death from stroke, the biggest disparities for African Americans. We were able to show it's not just mortality that is different, it's incidence. The occurrence of new stroke in one population group compared to another was greater. And this shows that one, men have a greater incidence of stroke across all three race ethnic groups than women. However, as you know, women live longer, so the number of strokes in women in the United States is higher.
Each year, 55,000 more women than men have a stroke, and that's true not just for all the women, even for women younger than 75 years of age. More women die of stroke each year than men. That translates approximately about 60% of all stroke fatalities are among women. Overall, prevalence of stroke is about 2.8% of people living in the United States.
When you actually look at the proportion of premature mortality, that you see that the very largest part is accounted for by the combination of behavior, healthcare utilization, and social factors.
And the whole goal of treatment is really to save the penumbra. So time is of the essence, so it's better to intervene at 30 minutes and at 45 minutes. The sooner the better. So there are certain timelines such as evaluation by physicians, notification of the stroke team, obtaining of imaging and laboratory tests, reading those tests, and then administering PPA ideally in the first 60 minutes. And this is a strong effort by the American Heart Association to get times of treatment lower, ideally in the first 60 minutes. Florida has a specific racial and ethnic distribution that is different from the rest of the country, with 16.5% of blacks, which is higher than the national average, and 22% of Hispanics overall in the state. If you look just at Miami-Dade County, for example, Hispanics account for about 65% of the county. The population in the state of Florida is centered around the coasts and in central Florida, and therefore it's not surprising that the stroke centers are also in those areas where we have largest concentrations of the population. The population of Puerto Rico is very different in that there is both European, Native American, and African ancestry. Perhaps this has something to do with the geographic differences in the prevalence of hypertension and related death rate in Puerto Rico. The geographic distribution of stroke mortality is greater in certain areas. This is the larger metropolitan areas with lower stroke deaths. And you see here in these yellow crosses the hospitals with an emergency room. And again, lower number of hospitals in this area where you have higher stroke mortality.
The impact goal for the American Heart Association is by 2020 to improve the cardiovascular health of all Americans. And that means white, African American, Hispanic, Asians, every single group in the United States. Mortality reduction is still in there, but improving health, shifting the population to better phases of health is critical. We are part of a larger effort, which is called a SPIRP, Stroke Prevention Intervention Research Program. And the mission is to eliminate disparities in stroke outcome in the United States. The goal of our Florida-Puerto Rico collaboration to reduce disparities is to eliminate disparities among Hispanics and other underserved populations. And we're working as a collaboration as we aim to hopefully have all patients with stroke receive the best possible care.
I must say that there is very little data out there, and hopefully Our group and the Florida-Puerto Rico collaboration to reduce stroke disparities will play an important role in delineating these disparities and hopefully reducing them.
We hope by first showing where there may be disparities, thinking about ways of improving education, and then feeding back to see if some of the trends and disparities improve will be the way we can try to close the gap. It truly is a collaboration involving many members across a large region of Florida and Puerto Rico, and we're looking forward to many more years of collaboration on this to hopefully reduce stroke disparities across the region.